So people want to know, what is my first visit all about? We schedule an hour. Some people take the full hour, some people don't. My nurses will start with the vital signs to get you ready to see me. You've already done your blood work, so we can get started and go over them. And then when we go over your symptoms, your health goals, we go over your lab results, and I start a plan for you. And the plan is each of the hormones individually prescribed for what you want. Not everybody wants all of them, and that's fine. It's your body. But what we do is we start the process. And as we start the process, I send your prescriptions to a compounding pharmacy or a commercial based on you. And then you pick them up and start. The first visit after that for men and women is about 2 months. We just see how you're doing. We don't do blood work yet. We get you ready for your labs. Once we do your second set of labs, if they are optimal, I see you once a year, unless there's other things that we're working on.